So yeah, hi everyone, I'm Hannah Wand. I'm one of the co-chairs of the Public Health Genomics Special Interest Group from the National Society of Genetic Counselors. We are co-hosting this series in 2021, where we're focusing on applications of public health genomics in practice. So this is the second webinar in this series focusing on policy. So we're very excited today. On the next slide, I think we have, yes, so we're co-sponsoring today's webinar with the Genomics Education Work Group of the American Public Health Association. And our moderator for today, Dr. Andrea Durst, is the co-chair of this working group. So she will be leading us through today's topic. Before we begin, just wanted to mention that today and throughout the series, you can claim Category 1 CEUs. You can claim this at the end of the four webinars, so that will end in about December. At the end of today's webinar, if you're a live attendee, you'll receive the evaluation link that you need to fill out to claim those CEUs. You can only claim it if you're a live attendee. There won't be any kind of knowledge quiz or anything like that. Just remember to fill out the evaluation. I think I wrote a little list of logistics, remember. I think that's mostly it. We're also going to record and it'll be posted on YouTube. We'll use the same dissemination channels we use to advertise the webinar to also provide that YouTube link. And feel free to share that more broadly if you'd like. So for today, we're going to have Andrea start us off with a brief overview, just going over the policymaking process for those of you that aren't familiar. And then we have three amazing panelists with us today that work in different settings and aspects of that policy process. So it'll be a nice mix to kind of see what people are doing, again, with applications and practice. So Andrea will lead us through introductions, and each of them have prepared a brief overview of the work that they do. Following that, we have prepared a moderated discussion, but we want to prioritize questions from the audience. So be sure to use the Q&A chat throughout, and we'll either answer that by chat or we'll have that be one of the questions that the panel discusses live. Next slide. Okay, so I have the pleasure to introduce Andrea today. Some of you might know Andrea as the Associate Program Director for the Genetic Counseling Program at the University of Pittsburgh. She's also the director for the MPH program there in public health genomics. She's a licensed genetic counselor with a clinical background in cancer genetics and also has her doctorate in public health and health management and policy. As I mentioned, she's co-chair of the Genomics Education Work Group, does a lot of education and outreach on public health genomics. And then in addition to that, co-chairs the Pennsylvania Cancer Coalition Cancer Group, in addition to being the advisory committee chair for the NIMAC Regional Genetics Network. So those of you in the Northeast and just broadly involved in genetic counseling have probably heard of her before. And she's very active with APHA. So thank you, Andrea, for being here with us today and leading us through today's topic.
Absolutely. Thank you, Hannah, for that introduction. And yeah, as Hannah said, I'm just going to provide a brief overview of policy and some of the factors that can influence policy before we move on to our panel speakers. So with that, I don't have any conflicts to disclose. And I wanted to start here with how do we define policy? There are a number of ways to think about policy, and I've included some of the definitions that really resonate with me here. So first, the CDC defines policy as a law, regulation, procedure, administrative action, incentive, or voluntary practice of governments and other institutions. And I like this definition because it's a broad definition. It includes not just laws and statutes, which is what we might typically think about when we think about policy, but also other actions as well as other organizations other than just the government. And we'll talk more about the spectrum of policy a little bit later on. I also like this definition by Thomas Dye, who's now an emeritus professor of political science down in Florida, who states that public policy is whatever governments choose to do or not to do. And I think that's really important. And I think that as genetic counselors, we all kind of know the implications at this point of policy that comes from what the government chooses not to do, especially as we continue to wait for a federal bill to be passed that recognizes us as providers under CMS. This also applies a lot of times in the case of funding. So, if a government chooses not to provide funding to support a specific policy or program, that choice can really affect whether or not that is implemented or enforced. And then the final definition I've included on here is more specific to health policy. And this is from the World Health Organization, and they define health policy specifically as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. And I think that health policy can really also be thought of more broadly, not just policies specific to health, because there are many different policies from different sectors that can influence health. So for example, we might not think about this, but transportation policies, such as the creation of bike lanes or sidewalks, those can in turn increase physical activity in a community. Or if we think about even access to healthcare, right? And for example, does local or state transportation provide access to hospital systems? Policies like that can really influence access. And so again, I like to think about policy as more of a broad category as opposed to just policy or laws and statutes, or just policies that are specific to health. And so we all know that policy is a significant component of public health. And you can see that in this pictorial representation of the 3 core public health functions, which include assessment, policy development, and assurance, as well as the 10 essential public health services. And the essential services really outline a number of ways that we can all become involved in policy development, including, informing policy and educating policymakers about important topics, supporting and mobilizing communities to support various policy initiatives, by creating, championing, and implementing policies, plans, and laws that can impact health. And again, thinking about that in a broad sense. And then using our legal and regulatory actions that have been designed to improve and protect the public's health. So I'm not going to get too into that because our panelists are going to be speaking about specific ways to get involved in policy, as well as some specific projects and current policy events that are relevant to the field of genetic counseling. All right, so as I mentioned previously, policy really extends beyond just laws and statutes that are implemented by our federal, state, and local governments. And in fact, policies from other organizations often have significant impacts on our practice as genetic counselors and public health professionals. So for example, professional standards of practice, guidelines, and recommendations, they all play really a large role in genetic counseling. And some of examples of these include the NSGC practice guidelines and position statements, insurance company guidelines for coverage, or national organization guidelines on who's appropriate for testing or maybe management of individuals with specific genetic conditions. And there may also be, and likely are, institutional operating principles and procedures in your own work settings that can influence genetic counseling and access to services. Coming from the area of cancer genetics, which is where my practice was before I joined the University of Pittsburgh, one, I think, really significant example of this in my practice was the implementation of universal IHC screening at my hospital, right? That took a number of institutional policies being put in place and the coordination of many different departments in order to increase that access to services for individuals who are diagnosed with colon cancer in our system. And then finally, I did want to mention social norms and expectations, as these often have a significant influence on health and health policy. So oftentimes, we need to think about not only policy implementation, but also the adoption of those policies in certain groups. And I think we all have kind of experienced how this impacts policy recently, with the impact of social norms and expectations really influencing a lot of things surrounding COVID, right? So if we think about the implementation and compliance of masking mandates, social distancing mandates, and many other issues that have kind of come up over this past year. So always important to think about, how are we going to influence those social norms so that the policies that we implement can be successful. All right. And then I just wanted to end my brief introduction today by talking about some of the factors that can influence policy. So first here we have information, and we all know that the education of policymakers on topics of interest is an important component of the policy process. In addition, values, so those of politicians, individual groups, and the general public as a whole, those can have a significant influence on what policies are introduced, championed, and implemented at the varying levels of government or in specific organizations. And then technology is a really important one, especially in the field of genetics and genetic counseling and public health genetics, because as new, more effective, and more efficient technology becomes available, right, we're thinking about policies that we maybe didn't need to think about before, that now need to be implemented or championed, and there may be increased support for those policies as well as technology makes things more possible. There are often economic considerations when implementing policy, such as the cost or cost savings associated with a policy being proposed, as well as the economic conditions overall in the country or the state or the local jurisdiction that might influence the creation and implementation of certain policies. And, while I think maybe we wouldn't like to think that this is the case, chance can actually play a really large role in what policies get championed or implemented. So for example, the timing and political climate might be right for a certain policy to be advocated for, or certain people may be ready to take up or join the champion of a certain championing, we're really having trouble with that word today, of a certain policy. So chance can really play a large role. And then finally, people. So people have a significant influence on policy, whether that's through lobbyists and special interest groups, public opinion, as I've talked about before, or individuals like ourselves. And so with that, I'm going to turn it over to our speakers who, again, are going to talk more about the topics of how to get involved with policy, as well as specific projects and issues of importance to our field. And our first speaker today is Cari Young. Cari is a senior health science policy analyst in the Office of Science Policy at the National Institutes of Health. She works in the Division of Biosafety, Biosecurity, and Emerging Technology Policy. Cari received her genetic counseling training at Johns Hopkins University and was the 2015 American Society of Human Genetics National Human Genome Research Institute Genetics and Public Policy Fellow. So welcome, Cari, and go ahead and take it away.
Thanks, Andrea. So if we can move to the next slide, please. First of all, no conflicts of interest to report. I do work for the National Institutes of Health, but I am just speaking for myself today. So first, I want to talk a little bit about sort of the flavors of science policy. Andrea did a really nice job of talking about the different types of policy and specifically health policy. I work in a slightly different area of science policy, which I'll talk more about. I'm also going to talk a little bit about sort of how genetic counseling skills and perspectives really translate well into the policy arena. And then I'll talk a little bit sort of about the fellowship that I did and how genetic counselors can get involved in policy. So to start off, some of the flavors of science policy are one, policy for science. So that's policy that impacts the conduct of science. So examples of this would be the NIH policy to balance sex in cell and animal studies. Sex as a biological variable should be factored into research designs, analyses, and reporting in vertebrate, animal, and human studies. So this is an example of something that NIH has put in place that sets a policy for how science itself is conducted. Another example would be the NIH genomic data sharing policy, which was developed to set forth expectations that ensure the broad and responsible sharing of genomic research data. So this is the area that I work in, is setting policies for the conduct of science. There's also science for policy, which is the application of scientific findings to public policy making, which is also a hugely important area. So examples of this would be, the National Action Plan for Combating Antibiotic-Resistant Bacteria. So this is something where science is conducted and it helps inform how policies are created. Lastly, is science diplomacy. So Andrea talked a little bit about norms, and this is one area that really affects that. So science diplomacy is a bit broader. It's the use of scientific collaborations among nations to address common problems and to build international partnerships. So as an example here, there's the Fogarty International Center at NIH that drives NIH's main global health diplomacy efforts. And really, global health diplomacy is a powerful force that can bring countries together to advance scientific discoveries, stimulate collaborations, and even when relations between countries are strained, health can be a compelling cause that all parties can really rally around. So this would be, some examples of this would be building research infrastructure, training researchers from other countries, or global health security efforts. So these are all sort of different flavors, again, of policy and science. But I'll also just say that genetic counseling skills really translate very well into policy. I think a lot of the folks that are involved in policy often have, government relations backgrounds, or the people that are involved in science policy often have PhD science backgrounds. The things that you learn as a PhD scientist are really valuable, but they don't necessarily train PhDs the same way that genetic counselors train. So for example, genetic counselors learn how to communicate with a variety of different audiences. They learn how to, translate very complex scientific information and help people make decisions based on that. You talk differently to an insurance provider and to a doctor than you would to a patient. And so again, I think these communication skills are something that are hugely valuable in policymaking. And in addition to those skills, I think the perspective of a genetic counselor is also hugely important. So the goal of science policy is really to create a framework that strikes a balance between preserving public trust in research and promoting rapid and exciting scientific advances. Genetic counselors come with a perspective of, having met with hundreds, thousands of different people who are making difficult decisions. And I think that perspective sometimes is lacking in the policymaking process and can be quite valuable. So if we jump to the next slide. As Andrea mentioned, my background is in genetic counseling, but I have made the transition into a policy role. And so I just want to talk a little bit about this fellowship that I did to sort of give an idea of how folks can make a transition if that's something that they're interested in. So this fellowship is sponsored by the American Society of Human Genetics and the National Human Genome Research Institute. The goal of the fellowship is really to translate genetics professionals and help them move into policy roles. So there are several genetic counselors that have done this over the years, myself included. Also PhD scientists can also do this fellowship. It lasts 16 months and it involves 3 different rotations. So first 4 months in the NIH within the executive branch. So that's at the National Human Genome Research Institute. So that's sort of seeing policy from the executive branch perspective. Next is 9 months in a staff position on Capitol Hill. So you'd work with a senator or a congressman or a committee in the legislative branch, which is, as you know, a completely different perspective. These are the folks that are making laws and appropriating funds. And then lastly, 3 months with ASHG in the nonprofit science advocacy sector. So it's a really good way to get a sense of the different types of policy that are out there and the different perspectives that the executive branch, the legislative branch, and the advocacy community and professional societies really have. There's a link here at the bottom, which you can also just Google Genetics and Public Policy Fellowship if you're interested. And I'm happy to talk more about that fellowship, but I think, it's a really good way if you're a genetic counselor that's interested in transitioning full-time into a policy role. But I also want to talk on the next slide about a little bit more about, folks that aren't looking to shift their whole career into policy, but do want to get involved a little bit more in the policy arena, because as I mentioned, I think the genetic counselor voice is really valuable, both in science policy and in health policy. And I think if interested, I think there are a lot of good ways that genetic counselors could get involved. So first, I'll talk from an NIH perspective. So NIH, when making policies, has a number of ways of reaching out and would like to get community input. So for example, before NIH is working on a scientific data sharing policy, they put out a couple of requests for information about that and receive responses from the community, and NIH is always looking for more feedback from different constituencies and stakeholders, both members of the public, researchers, but I think genetic counselors, again, have a really valuable voice, both those involved in research themselves and those who aren't. So RFIs are one really good way. NIH also often hosts workshops, which genetic counselors can consider speaking at or attending. Outside of the NIH perspective, many advocacy organizations, disease-specific ones, or professional societies have Hill days, which, when we're not all teleworking, involve actually going to the Hill and talking to congressmen and senators about specific issues related to a disease community or related to the profession of genetic counseling. And so that's another really good way to sort of jump in for a couple of days, go meet with congressmen and their staff, and really provide a valuable perspective. As someone that was on the Hill for 10 months, it was really valuable having disease groups come in and talk about whatever specific issues they were advocating for. You get to actually hear from the people that are affected by these issues, and that's a really valuable way to put forward your perspective. So I'm happy to talk more about that, but I'll pass it back over for now. Thanks.
Thank you, Cari. All right, so our next panelist is Dr. Stephen Modell, who is the Research and Dissemination Activities Director of the Center for Public Health and Community Genomics at the University of Michigan School of Public Health. He has co-taught the Health Management and Policy course titled Issues in Public Health Genetics for over 15 years and has many publications on topics including advancing cancer genetics in public health, cancer genetic testing in marginalized groups, and as well as multiple policy statements. So welcome, Stephen.
Thank you, Andrea, Ann, for having me here today. Stephen Modell, University of Michigan. I'll be discussing Medicaid coverage of genetic counseling and testing with you. I have no conflicts to report. Public health is concerned with those genetic conditions which affect populations and which are amenable to widespread screening and testing. Next slide. And next slide beyond. You see a couple of those examples here. Hereditary breast and ovarian cancer, or HBOC and Lynch syndrome, has garnered special attention in public health circles. For one, because use of genetic testing and family history have been validated for them on a population level. And secondly, they've received a lot of recognition by Healthy People 2020 and 2030. So that's what I'll be discussing today. Next slide. Here we have some Medicaid basics. The kernel is that individuals with an annual income of $16,000 or less, or families up to 4 members with a cumulative annual income of $33,000 or less are eligible for Medicaid in Michigan. The exact numbers vary depending upon the state. 39 states, including Washington, D.C., have elected to expand Medicaid so far. The percentage of uninsured non-elderly adults fell from 20.5% in 2013 to 10.9% in 2019. There's been a 9% decrease in the uninsured rate among African Americans in expansion states. And this is a little bit lower for non-expansion states, 7%. And for Latinos, it's 12% in expansion states and 8% in non-expansion states. Next slide. Let's talk a little bit about Medicaid coverage of bracket testing for HBOC and for Lynch syndrome. A 2020 survey by the advocacy organization Force, or Facing Our Risk of Cancer Empowered, reported that all but 3 states, which you have here, cover BRCA counseling and testing under Medicaid. This is an improvement from 2013, when 32 states covered these services. Next slide. Zerhouni et al. Conducted a survey published in 2019 that found significant increases in CRC screening rates by about 6% for the very poor, and this was from 2012 to 2016 in early expansion states. Zerhouni found 11% improvements in CRC screening under Medicaid in early expansion states for African Americans. The data for Latinos is a little bit less clear cut. There have been increases in screening rates for them, but the difference in trends between Latinos in early expansion states and non-expansion states was not found to be statistically significant. And that means that more has to be addressed for them. If we take a look at the state of Oregon, this state displayed a relatively high CRC screening rate compared to whites. The ratio is about 1.2. Possible contributors to this are a statewide public health campaign they mounted that promoted CRC screening and the use of community health workers, which is a staple in public health. A safety net hospital in Phoenix, Arizona was actually able to achieve, now this is jumping course a little bit, BRC counseling and testing rates of 78% in at-risk low-income Latino populations. This program utilized specialist training and financial assistance guidelines, as well as principles of cultural tailoring. Rural populations have also benefited. So we see that in the state of Kentucky, Medicaid patients have actually experienced a rise, something like 250% in those who have undergone CRC screening. Next slide, please. Let's take a look at the various strengths and gaps. So Medicaid expansion is proven to be a very important coverage option for those diagnosed or being diagnosed with HBOC or have survived cancer. The 3 states that do not currently cover BRC testing and counseling under Medicaid are Alabama, North Carolina, and Rhode Island. The question remains whether males are covered under Medicaid for these services. By and large, Medicaid coverage depends upon the National Comprehensive Cancer Network, or NCCN, guidelines, and the interpretation of these vary depending upon the state. Colorado has stated that males are excluded from coverage for BRC counseling and testing. The policy, if you attempt to find it on the web, is oftentimes not explicitly stated. Some states, like Indiana, will pay for diagnostic mammograms for both men and women who show clinical signs and symptoms. Right now, the decision on Medicaid coverage is in process for North Carolina and for Alabama. Now, next slide. In terms of Lynch syndrome, or previous slide rather, I guess I combined them, or hereditary non-polyposis colorectal cancer. This is the most common hereditary form of colorectal cancer, and it's especially pernicious variety. The majority of states do cover genetic testing for Lynch syndrome mutations under Medicaid, such as MLH1 and MSH2 mutations. However, most Medicaid programs do not cover multi-gene panel testing. Next slide. So let's wrap up with advocacy. Forrest has been very instrumental in securing coverage of women with a positive family history of HBOC who have an identified mutation within the family. And further efforts by the advocacy organization FORCE led to a clarification by 3 federal health agencies that women with a past history of cancer are also eligible. What we find is similar movements for BRCA testing in North Carolina. In 2018, Pam Greason, a nurse with the North Carolina Department of Health and Human Services, as publicized by Cancer Care, submitted an 8-page commentary to the North Carolina Division of Medical Assistance and Physician Advisory Group, calling for coverage of genetic testing for HBOC. Her comments start, our 30+ organizations represent millions of Americans, including North Carolina residents affected by hereditary breast, ovarian, and related cancers. North Carolina opened up its public commentary on coverage for BRCA testing and counseling in May of this year. And we hope that those comments that come in from the lay public, from interested policy-related individuals, and for experts cement her call for action. Thank you very much.
All right, thank you so much, Stephen. I'm going to move on to introduce our third panelist, who is Sonia Suter. She is the Kahan Family Research Professor of Law and founding director of the Health Law Initiative at the George Washington University School of Law. She earned her MS and PhD candidacy in human genetics, as well as a JD from the University of Michigan. And as a former genetic counselor, her scholarship focuses on issues at the intersection of law, medicine, and bioethics. So welcome, Sonia.
Great, thank you for having me. Next slide, please. I have no conflicts of interest to disclose. So I want to talk today about 2 very different hot topics that are relevant to public health genetics. One is the use of consumer genetic databases by law enforcement, and the other is legislation that bans abortions based on reasons, certain reasons, sex, race, or genetic anomalies, which is what would be of particular interest to this group. And these are important areas with respect to public health genetics because they impact individuals' attitudes towards genetic testing, particularly the forensics, and options once people get testing with the reason-based abortion bans. And I also want to talk about these 2 areas to compare how different the policy approaches have been. Now, in the first area, policy is just starting to be made, so it's a work in progress, but I just want to compare 2 different approaches so you get a feel for how in the legislative realm, policymaking can really differ. Next slide, please. So I'll start with the first topic, which is the forensics use of consumer genetic databases, which is sometimes called investigative or forensic genetic genealogy. I'm calling it IGG for the talk today. I want to tell you a little bit about the issues with the technology, why it raises concerns for policymaking, and then discuss specifically policymaking in this area in Maryland just this year. So as you probably all are familiar, the technique was used in 2018 to identify and arrest the Golden State Killer, Joseph James DeAngelo, who was convicted just almost exactly a year ago for a series of rapes and murders in California that were unsolved for several decades. In that case, the police uploaded a genetic profile from the crime scene DNA to several consumer genetic platforms, which then identified several distant relatives. And then based on the genetic relatedness and public records, they built out large family tree and with other information narrowed it down to DeAngelo. Next slide, please. So law enforcement after this case was very quick to embrace the technology. And so far it's been used to identify or arrest a suspect in 70 violent crimes and to generate leads in nearly 200 cold cases in the United States. Next slide, please. But the technology raises a number of concerns, one of them privacy concerns. So first, one of the concerns is that the databases, the information in the databases are based on SNPs, which you all know can provide potentially large amounts of information about disease risks, potentially certain traits, ethnicity, and genetic relationships. This means that in theory, the government could use the SNPs for more than just identification purposes, which troubles people. The privacy risks are heightened because the DNA profiles come from innocent people who want to take advantage of consumer genetics. They probably weren't contemplating the use of their DNA to identify criminal suspects in their family, or even to have their genetic profiles in the hands of law enforcement. Next slide, please. So to Andrea's point about public opinion, a 2021 survey found that 70% of respondents in a USA survey rated government use of consumer genetic platforms for forensics uses to be intrusive, and a similar majority found that the technique violated a reasonable expectation of privacy. Next slide, please. Another concern is how DNA might be used to probe and surveil families, threatening the civil liberties of innocent family members. IgG can potentially, using SNPs, link crime scenes to individuals, or link individuals themselves to first, second, third, fourth, even ninth cousins, which means that the genetic genealogy subjects a very large number of individuals to potential government surveillance, and possibly to surreptitious collection of DNA, because the government, even if they don't think certain individuals are suspects, they might need that genetic information to fill out the family tree. This kind of probing of families can threaten familial privacy in a few ways. It can potentially reveal unexpected biological connections, or it can unveil the lack of biological connections because of adoption, gamete donations, or adultery. Next slide, please. On the other hand, the technology clearly offers some benefits to society. Obviously, as in the Golden State Killer case, it can help solve crimes and thereby promote public safety. It's also important because it can be used to exonerate the innocent, and it promotes victims' interests by identifying perpetrators of crimes and leading to their punishment. Next slide, please. But until recently, there really was no regulation. And so as Andrea pointed out, the policy here was essentially to leave things. Actually, I think I need to go one slide back, please. Okay, the slide seems to be moved. I'm not sure, I'm missing a slide there. I guess it's just not there, so we can hold off. Until recently, the primary restraint on law enforcement came from consumer genetic platforms themselves. So they weren't being regulated and they were making their own decisions. Some of them refused to cooperate, some of them did so covertly, and a handful worked openly with criminal investigators. Two of the sites, GEDmatch and Family Tree DNA, faced a lot of criticism after the public and the site users learned that they'd been secretly allowing law enforcement to use their databases for IgG. And although both sites ultimately unilaterally altered their terms of service and privacy policies to explicitly allow law enforcement use of their sites, some other sites have come under attack for violating their own policies, for quietly changing their settings, or in some cases for failing to delete material as promised. Law enforcement actions in these areas have also been troubling. In some cases, they've tricked family members into voluntarily donating their DNA for investigative use. As I mentioned, they have surreptitiously collected genetic material from non-suspect family members to build out the family tree. And in the Golden State Killer, the genealogist who was working with the investigators pretended to be an ordinary site user at a site that did not cooperate with law enforcement to gain access to the consumer genetic data. And so far, courts have largely taken a hands-off approach. Next slide, please. So recently, until recently, the sole effort at sort of formal policymaking emerged from the US Department of Justice, which issued an interim policy in 2019. But the problem with this approach to policymaking is that it was very one-sided. It was coming just from the law enforcement side. It's also coming from the federal side, so for the most part, doesn't have any impact on state law enforcement use of these databases. Next slide, please. That's the slide that I was going to show you. So flip one more, please. So just this year, Maryland became one of only 2 states, Montana being the other, to enact a law regulating IgG. And I focus on Maryland because I was part of that process and also because its law is broader. This law was adopted with near unanimous bipartisan support. And I also think it's worth talking about this, not just because this is a sort of cutting edge issue, but also because Maryland's approach offers really a model for how to enact policy that appropriately balances competing interests. And in this case, the interest in protecting genetic privacy, civil liberties, and public safety interests. So the process began with two legislators, one from the Senate and one from the House of Delegates, who convened a working group of stakeholders and experts in areas relevant to this technology. So it included law enforcement, people in genetics, forensic laboratories, lawyers, bioethicists, criminal defense attorneys, and prosecutors. And over several months, the group worked, and I was part of that group, to debate the various approaches to regulating IgG. And then based on these conversations, the legislatures crafted what we think was a balanced approach to regulating IgG so that it could be used to solve crimes, to exonerate the innocent, to identify human remains, while minimizing the threats to privacy, inequality, and civil liberties. So next slide, please. The law also, I just want to tell you about some of the key features of the law to see this balancing. So the first thing it did was require judicial supervision of law enforcement use of this technology, and then impose certain constraints, for example, limiting it to serious crimes and ensuring that other investigated methods had been exhausted. It also gives individuals control over the investigative use of their genetic data. So it's not enough for a site to offer explicit notice that they will allow law enforcement to use the data. That could be buried in provisions people don't notice. It actually requires affirmative consent from the users. Third, Maryland's new law establishes robust procedures for obtaining additional DNA samples from third parties who are not suspects, but might be related to a putative perpetrator and whose DNA might be needed to fill out the genetic family tree. This provision creates a strong presumption in favor of obtaining informed consent and prohibiting covert collection once a third party refuses. And I think this group will find this next part really interesting, and I was really pleased with this. It requires genetic counselors to train law enforcement officers about how to appropriately obtain informed consent from non-suspect third parties. So I think this was a case where a former genetic counselor being on the working group was probably helpful to the process. The law also ensures that the technology can be used not only to prove guilt, but also to prove innocence. And another provision that I thought was really important was to create a private right of action for individuals whose genetic samples or information is inappropriately or wrongfully disclosed, collected, or maintained, with a minimum of $5,000 for such violations. And then finally, the law creates transparency. And this goes to Cari's point about trying to have policy that builds trust in the public about science. So the transparency and oversight is achieved by requiring a public report each year about how the technology was used, and then a review of that report by an expert panel with the option to make policy recommendations. So I think this is an example of policy making that really works by bringing all the relevant parties together. Next slide, please. At the other extreme, we're seeing a rapid increase in laws that ban abortions based on either sex, race, or genetic anomalies. And the approach to this legislation has really been quite different. It has not involved engagement with all of the relevant stakeholders. And ostensibly, the laws are driven by concerns about eugenics and discrimination. I mean, so here's where attitudes and norms can play a role in policymaking, and I want to show how this is really sort of taking hold with the next slide, please, which talks about how Justice Thomas wrote an opinion in 2019 in Box versus Planned Parenthood, where he made those arguments about eugenics. So the case involved an Indiana law that banned abortions based on race, sex, and genetic anomalies. The Seventh Circuit Court of Appeals, which is just below the Supreme Court, found that the law was unconstitutional. Indiana appealed, asking the Supreme Court to consider the issue. The Supreme Court refused to take up that issue. Justice Thomas wrote a concurring opinion essentially to say, okay, I agree that we shouldn't take up that issue at this point, but he wanted to emphasize why he thought that the court should consider the issue in the future. And the main purpose of his opinion was to connect the horrors of the eugenics movement with reason-based abortions. And so he spends much of his opinion linking abortion to eugenics, describing abortion as rife with the potential for eugenic manipulation, as implementing the discriminatory preferences that undergird eugenics by focusing on immutable characteristics and pointing to high abortion rates and with respect to Down syndrome in countries like Iceland and even the United States. And he concludes his opinion by stating that finding a constitutional right to reason-based abortion bans would constitutionalize the views of the 20th century eugenics movement. Now, many historians have viewed his account of eugenics as misleading and inaccurate, but this opinion is shaping how legislatures approach this issue. It is shaping how the public thinks about it. Next slide, please. So with a change in the composition of the court and with the growing emphasis on this view of eugenics that Thomas offers, we're seeing a real proliferation of proposed RBA bans across the country. From 1975 to 2009, there were only 2 such laws enacted. They focused only on sex, and there were only 14 introduced. But since 2010, we've seen a real uptick in these laws. All states but 10 and DC have introduced some form of a ban. And since 2010, 173 bills have been introduced, with the highest number, 33, just in the first half of this year. Next slide, please. So far, 20 bans have been enacted in 15 states. The green ones are the laws that are in effect. 1 is scheduled to take effect in pink, and then 6 have been partially or fully blocked by the courts. And in a moment, we have a split among the federal appellate courts, so the courts just below the Supreme Court, with the 6th Circuit and the 8th Circuit saying these laws are constitutional, and the 7th and 8th saying they're not. So with Justice Barrett replacing Ruth Bader Ginsburg on the court, it's highly likely that the court will consider whether these laws can stand in the not too distant future. So we see then the legislative branch being affected by what the courts say. And that's another way that policy can be affected. It's worth noting that Justice Barrett joined a dissenting opinion when the 7th Circuit found that its reason-based abortion ban was unconstitutional. So we know what her views are on that. And that opinion was not so dissimilar from the opinion that Justice Thomas wrote. Next slide, please. So from a policy perspective, we see that Thomas's eugenics arguments are really showing up to be used to justify these bans with either explicit or implicit references to eugenics. Of the 20 states that have enacted such laws, 2 of them have explicit references to eugenics. But of the 29 bills that are under consideration this year, 7 of them have such language. Next slide, please. And I just want to give you a feel for what this language looks like. Mississippi enacted a ban which quotes much of the Thomas opinion by saying that the law banning these abortions prevents these immutable characteristics from being the sole criterion for abortion. It describes abortion as having the potential for eugenic manipulation and the risk of its becoming a tool for modern day eugenics. And then it describes the statute as promoting equality and helping the disabled community. Next slide, please. This view of eugenics is not only grounded in a misleading view of history, it's also very narrow, focusing only on individual reproductive decisions, but it really taps into common views across ideologies that many reprogenetic decisions are a form of individualized or new eugenics. A lot of people try to distinguish that kind of eugenics from the eugenics of the 20th century by saying that individual decisions are different than state control. But of course, the eugenics movement did encourage individualized decisions. The real issue with the way that eugenics is being promoted to enact these laws is the antidote to concerns about eugenics. There is enormous irony in imposing this kind of state control over reproductive choices to prevent eugenics. And even more, it's problematic in ignoring the larger social and personal circumstances that impact a parent's ability to care for any child, let alone a child with a disability. And these laws are not enacted after considered analysis of the issues at stake. The legislatures didn't engage with genetic counselors, with ethicists, with the disability community, or other relevant groups to consider what do we mean by eugenics, what's problematic about eugenics, and how do we address those kinds of concerns. Ultimately, I think the cynic's view would be that this is just one more attempt to limit reproductive rights. But it really does reveal how differently legislatures can approach policymaking. So even though that's one aspect of policymaking, you can have a very careful approach that really brings all the views in, or you can have an approach that's very narrow and that I think commandeers one view to try to achieve another goal. And so really elections matter in policymaking. Thank you.
All right, thank you, Sonia, and thank you to all of our panelists for such great presentations today. We do have a couple of minutes now where I would like to open up discussion to our panelist members on the information that was presented today. So panelists, if you have comments or questions for each other, I welcome you to share those now. I'm going to stop sharing the slides so that we can see everyone's face. All right, yes, Stephen.
I was really stimulated by both of my co-panelist talks. Cari, when your fellows go to the Hill, Capitol Hill, do you have any sense of what categories of legislation they buff it up against? And thinking of maybe the Affordable Care Act, which had great influence on Medicaid and Medicare, maybe something more specialized, maybe maternal and child health. Have you got any feedback from them?
Sure, yeah. So I can talk a little bit about the types of legislation that I worked on and the types of hearings that I supported the senator that I worked for when I was on the Hill. You know, I think a lot of it is a nice feature of the fellowship is that the fellows can interview with a variety of offices and try to find a good fit. And part of that involves, you know, hearing about what issues that senator or congressman cares about, or if there is particular legislation that they're working on. For example, when I worked for Senator Whitehouse, worked on a bill related to end-of-life care and Medicare coverage, which, you know, is not something even close to what I'm working on now, but I think, you know, end-of-life care is something that genetic counselors certainly interact with. And so, you know, that was also the year that Zika was busting onto the scene. So, you know, this isn't necessarily a piece of legislation, but we would track what was the updates that were going on as we were figuring out exactly what was happening with Zika virus, and, you know, kept the senator up to date with that. But yeah, certainly, I think some of my fellows over the years have worked on various parts of the Affordable Care Act. When I was on the Hill, it was when 21st century cures was being discussed, which has a lot of provisions that are relevant to the conduct of science and to health policy. And so it really is a mix of things. And I think that's part of the value of the fellowship is, you know, these folks on the Hill are dealing with such a wide range of issues, right? Like one day you're working on the specifics of Medicaid expansion, and the next day you're working on, you know, Zika virus or a question about a hearing on something that you may never have thought about before. So it really is a great deal of breadth, whereas, you know, the time in the executive branch is much more focused on the research portfolio and the policies around human genetics research. So it's quite a range, and depends a little bit on who you end up working with.
Keyword being flexibility. Mm-hmm.
That's right.
I ask a question that's kind of, I see it, I'm going to modify it from Sarah's comment here. Just wanting to learn more about, or advice rather, in how genetic counselors and other, you know, healthcare providers that are more maybe clinically informed and facing to be more involved in disseminating that information to the general public audience, or even like policymaker audience. I know, Sonia, you mentioned, you know, genetic counselors being on that work group for the Maryland law. Cari, I think you were the one that also mentioned that genetic counselors can get involved in different work groups and committees and things like that. So for GCs that don't have that experience or networking, perhaps, do you guys have advice on how they start to branch into those different stakeholder groups?
Yeah, I mean, I think this is huge and really, really important, more important than ever, because there's just a lot of misinformation about science generally and genetics specifically. And so I think that there are a number of ways one can do this. I think that if there are issues that are really important, I think op-eds can be powerful ways to start to get ideas out there. You're going to reach a larger group there. It's a little bit different than getting to legislators directly. So if there is an issue that's of particular interest to you that you feel needs to be considered by a legislative body, look at the legislators that might be receptive to those kinds of issues, and then reach out to their staff, whether it's at the state level or at the federal level, to try to get them to pay attention to those issues. Another thing to think about is when there's policy making through agencies. When new rules are being proposed, there will be a solicitation for comments. And so that's a really great opportunity to bring in expertise. And those are supposed to be carefully looked at and considered. And you can write pretty detailed information to ensure that the agency thinks through that, whatever the issue is. So it really depends, as Andrea pointed out, there's so many different ways in which policy is understood. And so you have to think about, where is this going to be affected? Is it going to be an agency decision? Is this going to be a professional guideline? Is this going to be through legislators or even through the court? So sometimes when the Supreme Court's considering important opinions, for example, if the Supreme Court takes up reason-based abortion bans, that's going to get a lot of attention. This would be a great opportunity for the National Society of Genetic Counselors to write about how difficult this would be for the services you're providing if people would not have the opportunity to terminate pregnancies based on genetic anomalies. And so writing amicus briefs to try to get the court. Now, I'm not going to be, I'm not going to be Pollyannish. I don't know how much that sways this court. I can count up to probably 5 who would think that it's just fine to have these bans, but it's still worth making those arguments. They get read by people. So there are a lot of different ways to do this.
Yeah.
Are we going till 15 after?
Yes, so good point, Stephen. So our webinar does go until 1:15. And so we do have some time for additional discussion and questions. We know some people might have to hop off at 1 o'clock, but just remember that this is being recorded and will be available publicly on YouTube. And we'll be sending that link out to all of the participants. So we hope you can stay, but if you need to hop off, you can look at questions later.
Cari?
Yeah, thanks. So I just wanted to, I agree with Sonia, I think, in particular about one place to get involved in policymaking is really when agencies are coming up with policies and with rules. As Sonia mentioned, there's often requests for information or things go out in the Federal Register that I think genetic counselors, again, are very well positioned to provide feedback on. And I've been on the receiving end of some of those requests for information. It's really helpful to have really specific suggestions because, that really helps us tailor the next draft and whatever final policy that we're coming up with. I will, make a specific plug. The Office of Science Policy has a news blast that you can sign up for. So whenever we put out an RFI, that's something that would go out there. Or sometimes there's workshops that may be relevant. So I would suggest that. I would also say, from my time on the Hill, that reaching out to your congressman, send letters about what you care about. I would really suggest doing that.
And then I would advocate going to the APHA website. They have legislative updates, which exist both at the federal level and some of them are directed to states. And these, they enter areas that involve NSGC members like reproductive health or maternal health. And you can also receive action alerts from APHA. If you fill in information, you can end up sending your advocacy request to the legislators in your state. A great source of general information is the CDC Office of Public Health Genomics and Precision Health website. They give you weekly updates. And there's also a page that's devoted to genetic counseling and testing. I saw a slide that flashed, and there are national organizations that look into state laws, and um, the exact name defies me at the current moment, but if you plug in national laws, governors as key terms, you'll bring those up.
Great. Thank you. So we have a related question in the chat. We've talked about how genetic counselors can get involved in policy and policy making. This one was directed at Sonia, but I think anyone from the panel can answer or weigh in on this question. So we talked about genetic counselors, but what are more ways to get other stakeholders involved in policy making? So is there anything that we can learn, for example, from the Maryland example that you presented that can be maybe applied to the reason-based abortion laws?
Yeah, so I mean, I think, you know, the topics are different. So I think it's a little bit harder because abortion is such a you know, such a controversial topic, and a lot depends on the nature of the state's legislative body. So Maryland, it leans more Democrat, and, you know, other states, you're going to have those issues. But I think trying to kind of respond to the rhetoric, to educate, to still speak to those legislators. So if you see states that are contemplating this kind of legislation, if they're doing proposed laws, kind of reaching out to the legislators are going to be sympathetic to these arguments, to try to present the counter view about what is really at stake here. That, you know, if we say that we're concerned about eugenics, then why are we not doing things like offering Medicaid or care for all these families, right? If you really care about this, I'm working on a project that shows all the ways that the states that are promoting these laws are doing the very exact opposite. They are not making it easy for people to have children with disabilities, right? So if that's really what you're worried about, then offer those kinds of social supports. And if you can kind of highlight that to legislators, then I think that makes it harder for them to make those arguments. So if you can give the tools to the legislators that are, and here's another site about where you can get information about legislation. If you can kind of get that information out there, part of why I'm doing this project, it feels like it's stating the obvious, but you need to point out the sort of serious hypocrisy of what's going on. So you have to call them out and what they're doing. In the Maryland case, the way it unfolded was that one of the people on the group had written a piece that one of the legislators had read. So he invited her to work with him initially, and then she invited me and some other people. So this is the power of getting things out there that are widely read, so that people who want to engage you in the discussion might do that. And that could potentially expand beyond just the direct-to-consumer category.
I'll have one more question, also kind of modifying from the chat again, and this might take us to time. So it was specifically around like the role of international genetic counselors and how they might also contribute to policy, but I kind of want to expand that question. There's a huge push in our field right now to diversify our workforce, and by intentionally doing that, I hope we're also then being inclusive of what those voices and communities are that we're representing. So what advice do you have for people in terms of like the different backgrounds and stories and populations of interest that they're trying to advocate for? How do you translate, I guess, that personal advocacy into your work at the policy level? And if someone wants to tackle international students, I think that would also be good, because I know that's a whole other can of worms, but I won't put the onus on you to know the answer for that one.
Well, it seems to me you should start out by investigating your professional organization, which in this case is NSGC, but also the American Medical Association website has quite a bit about care for the health concerns and rights of racial ethnic minorities. So you can get to that in 2 or 3 jumps within their website. I would believe that the CDC has similar information. Mm-hmm.
And quite the same thing, but we think a lot about increasing diversity in research participants. This is a huge problem in, genetic sequencing studies, for example. So, I think From a genetic counselor perspective, there's a real opportunity if you encounter folks who want to get involved in research, which I know is a lot of the patient population that genetic counselors work with, pointing people towards research studies, and that involves keeping up with, whatever field you're working on, and directing people towards those research studies, because that's one way to increase diversity on the patient population and research participant side.
I don't have a lot to add. I think that those answers were pretty complete. And I have to confess that I was getting slightly distracted in trying to respond to Robert Vesta's question, which I thought was an excellent question, but that's unrelated to what you just asked. So I was starting to try to type out an answer to him.
Did you want to verbalize it now?
Sure. He raises the question about how strange it is that these RBA laws ban abortion based on race, which, why would a person who's of a particular race ban, it doesn't make a lot of sense. And I was going to suggest that this is part of that same sort of rhetoric that tries to commandeer anti-discrimination. We're pro anti-race discrimination, anti-sex discrimination. So the first such law that was enacted that it combined both race and sex called it the Susan B. Anthony and Frederick B. Douglass Act, to try to say, oh, well, we really care about women's rights and about minority rights. But I mean, nobody's terminating pregnancies based on race. And then it sort of gradually included the others. So I think it's more of, very clever approaches to make laws palatable to a community that wouldn't find it palatable if they really thought through all that was going on.
That's really interesting.
By the way, I should mention that an organization called ELSI Hub, and I believe that Columbia University and Stanford University helped to support it, as well as NHGRI. They're having a discussion. Ellen Wright-Clayton, who's an MD-JD, will be one of the speakers. This happens on July 15th, and it'll be on the legality of abortion, considering what Sonia has been talking about, and implications for prenatal care. In the sessions that they host, there's plenty of time for both learning and for suggesting your own thoughts. Mm-hmm. And you have people who are interested in genetics, providers, policymakers. Maybe you'll hit a resonant chord.
Yeah, I think that's a really good suggestion, because it's a very broad range of topics. So there's going to be many issues beyond just this that people might want to get involved with. And then that can help you make contacts with other people. I think the really important thing here is that what you're trying to do is create interdisciplinary thinking about issues. I mean, that's really what we need. You need the people who understand how policy is made, but you also need the people who have the science, the clinical background, the public health background to understand the implications of laws. And so the more that you can sort of connect with these different groups to find colleagues and partners in advocating for particular positions, the better your opportunities for affecting change.
Right, and we are running close on time, but there was one other question in the chat specific to you, Cari, that you should be able to answer pretty quickly. If you know, is the policy fellowship that you did open to international graduates in the US?
Yeah, so the fellowship is designed for people that would like to pursue a career in policy in the United States, but you do not need to be a United States citizen to apply. So you just have to be able to work legally within the US.
And actually, sorry, one more short, question for you, Stephen, in the Q&A. At least in California, the trend is for Medicaid patients to automatically be placed on managed Medicaid plans, which act then as a very strict HMO. In your opinion, do you think this improves access to care, or does it end up harming patients? I'm not sure how easy that is to answer, but.
Yeah. That's a very good question. I've heard about that arrangement. First having to be placed on managed care being done in other states. Managed care obviously has its pluses and minuses, but I find that if you get into managed care, then you know your providers. And sometimes there's a little bit better discussion about, hey, I have this condition, or a family member urged me to come here. And can you suggest services or link me up. It's the process, the diagnostic process is eased. On the other hand, you have to worry about the time issue. If there's a, the residue of a per capita policy where we only have 10 or 15 minutes for you, then that can shrink patients' options. So the easy answer is there are plus and minuses when there's a managed care policy in a state. And the way that it's used perhaps depends upon the individual and what system of managed care within the state they can get into. In California, you've got Kaiser Permanente, right? Which has done a lot of community activities as far as genetics goes. And its practitioners have information available to them which can point in the right direction. Mm-hmm. And Kaiser Permanente has a managed care option.
Well, thank you so much to all of our panelists. And I hope for the attendees that this was helpful to get a better understanding of this range of policy that I know has been a question from our SIG for a while now to better understand what we even mean by that.